What ends up happening is you create that dam, and then you've got a terrarium on the other side of that, right?
You got this beautiful little ecosystem.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Welcome back to another brand new episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Michael Squires.
Whenever we talk about earwax, I get way too excited.
Yep.
And I think this is like Dr. Michael and I's first time discussing earwax.
Yep.
This article was written by Dr. Kelly Noloff of Birkdale Audiology in Charlotte, North Carolina. So today we're not really going to be talking about necessarily color or texture or density of earwax. No, instead we'll be discussing the smell.
Oh, yeah.
Of earwax. So as I often do, Dr. Michael, I want your best just generic earwax removal story. And then if you have a smelly earwax story, I want to hear that too.
Okay. So we're gonna kick off with that, huh?
Go generic first, then go smelly, then we can actually dive into it. But this is for my own personal fascination.
Oh yeah, no problem. So I want to preface this by saying I'm all in on earwax.
Love it.
Like as an audiologist, I know some audiologists who are just not all in. And they'll do it because it's part of it, but I'm all in.
I asked Dr. Jordan this, if you found your free time in between being married and having kids and working, would you be an audiologist that watches earwax removal?
Yep.
Okay.
I would be the audiologist that does the earwax removal that other people are watching.
Got it.
Yeah. So I actually
and then you rewatch your own stuff.
Yep. I have a cerumen removal clinic. I used to run it all day on Fridays.
Okay.
But now it's kind of mixed in with my schedule. But yeah, I do it all the time. I love it. It's so satisfying. Okay. I'm going to call it foreign body instead of wax.
Sure.
A tick. And I had a patient come in and go, something's just not right.
Yeah.
And I knew this patient personally, and she said, is there any possible way you could just look in my ear?
Yeah.
I said, girlfriend, you got a tick in there. And it was
big?
It was hanging on. She went camping. She went camping. And when she came home from camping, she brought a friend.
That's where, like, I don't know that I could ever graduate to foreign body in the ear removal, but that is, that's a lot.
Ticks, Q-tips, batteries, hearing aid batteries.
Batteries? Oh, okay.
Yep. Taken those out before.
I've obviously heard of spiders. Yep. I've heard of like baby cockroaches finding their way in there. Like insects and ears seem to do really well together.
They're hand in hand as friends.
Oh, that's
they
not
shouldn't
good.
be.
No, they should not.
And that's what wax is for. We'll talk about that here in a minute. Okay,
perfect.
The grossest story.
Yeah. The smelliest, grossest story.
Okay, so I have two.
Trigger warning for anybody listening.
Like, there's no visual, but if your stomach turns, bear with me. I have two of them.
Dr. Michael can craft a tale, so he will catapult you there.
Yeah, here we go. I got my brushes ready. We're gonna Bob Ross this thing.
Yes.
So one of them was in grad school.
Okay.
So when I was, I think I was in my third year. So we were doing clinic rotations, and I was in a hospital setting, and I had a young gentleman, probably around 8 or 9 years old.
Okay.
Mom didn't understand why he wasn't listening, couldn't hear anything. He walked right in and sat in our chair, and I smelled him coming in.
Oh, wow.
He had green pus running down the sides of his face. Yeah. And I said, we think we found the problem before we even started.
No kidding.
We bypassed diagnostics. We went straight to ear, nose, and throat. I mean, he had a raging bilateral, both ears, ear infection.
Oh my gosh.
To the nines, to the moon and back.
Is that just medication?
Generally what they'll do is it depends. Is it if it's a viral infection or a bacterial infection? Sometimes they can do like topical powders or something like that they spray in the ear if it's bacterial. Sometimes antibiotics, something like that. Yeah, it depends. It just depends on what's causing the issue. Now, number two, I had an elderly patient, and she was clogged up. We'll say it like that. She said, this ear has been bothering me. Her equilibrium was off, which can happen with wax occlusion. We'll talk about that here in a second too. But she said, I just need to get my ear cleaned.
Yeah.
Any pain, pressure? Yeah, just a little bit of soreness coming from that side, which is always a red flag.
Okay.
Sometimes with a wax impaction, there can be soreness if they go digging around in there.
Sure.
But she said she hadn't. So it looked pretty run of the mill. I went for it, and we removed that out, and it was like tearing down a dam and having a river of just blood and pus coming out behind it. Yep.
What was the actual diagnosis of what the issue was?
Oh, it was another just raging ear infection. Yeah, rage.
So
really bad ear infection.
How did it get? Did the wax make that infection happen? Is that what happened?
Not necessarily.
Okay.
And so this is actually a great segue into what we're talking about today, right? Smelly earwax.
Yeah.
So are we smelling the earwax? Because earwax itself typically doesn't have much of a smell, right? It shouldn't have any more smell than, just like any other.
Well, because it's your own body, right? It's your own oil and skin.
Yes, it's exactly right. So there's a couple glands in the ear canal that produce earwax. Sure. So the ear canal itself, a portion of the ear canal is skin on cartilage, the portion of it is skin on bone, and the transition between the two is where those glands are found. Okay. And so what ends up happening is some combination, and one of them is an oil gland, and one of them is it produces this waxy substance, right? So earwax, and the combination of those two things, that's what produces our earwax.
Got it.
For some patients, we just don't have a whole lot, and for some patients, we have a whole lot, right? And I have patients that I clean their ears every 3 to 4 weeks.
Wow.
I see some patients every 6 months. I see some patients annually, and it really just, and everything in between. Right. And so for patients who have an overproduction of wax, sometimes that can get occluded. And even if it's not occluded, sometimes it can just hang out in the bottom of the ear canal. Now, what most people don't realize is if you Google the image of an ear canal, so if you just go to like ear canal anatomy, what you're going to find is a picture of a relatively straight ear canal. Yeah. Every diagram that we have just shows like this just very slight bend. Ear canals just are not made like that. Sure. Most ear canals have a pretty good bend in them, like an S shape, okay? And so the reality is that S shape is protective. It's to help keep moisture and water and things like that out of there. But like we know, there is something called swimmer's ear. And what swimmer's ear is from is water getting around that S shape down to near the eardrum and just hanging out there, right? Yep. And so if we have wax that sits along the bottom of the ear canal, water gets over top of that wax and it provides like a little bit of a dam, right? Yep. And that water can't get back out. So it ends up just kind of sitting in there like a petri dish. It harbors bacteria, and then we get a bacterial infection. And most of the time, that's what you're smelling.
Got it. Yep.
Right. Kind of gross, right?
Sure.
But nonetheless, it's something that really needs to be treated. We see it a lot in kids who are swimming a lot. Yeah. But quite honestly, I see it a lot in adults as well. Now, the other thing that can happen is the environment in the ear. Yeah. It's not sterile. Right. And it's very warm. Yeah. It's very moist. So even hearing aids sitting in there can help to, you like an in-the-ear hearing aid, for example, something that fits down into the canal will help to compact some of that wax. Of
course.
So it needs to be monitored and removed regularly.
Got it.
Q-tips. It's like loading a muzzle loader, guys.
We know it's bad news.
You're just packing it down in there. And what ends up happening is you create that dam, and then you've got a terrarium on the other side of that, right?
You get this beautiful little ecosystem.
Yeah, you get this moist environment, and it's just ripe for bacterial growth. So oftentimes, smelly wax is wax plus something else.
So smelly wax is obviously just different than normal wax because it's smelly, and it could be for a myriad of issues, but there's no difference in the extraction of that smelly earwax for the most part.
Well, there can be depending on the severity of the infection, right? If we look at an ear and we can tell that it's really infected and really angry, the ear canal is going to be really red. If they went in there with a Q-tip thinking that they're going to clean things out and make it all better, they could have scratched the ear canal. They go in there with patients go in there with everything: keys, paper clips, fingernails, you name it. I've heard it or seen it. Yeah. And so what you end up doing is creating a scratch or laceration in the ear canal, which is just begging for an infection. Yeah. Right.
So typically, though, you would still use a curette or like an irrigator or the alligator. What do they call those things?
Yeah,
pinchers,
like alligator pinchers. Yeah,
or
that's the scientific. Yeah, I think that's the scientific.
That's what they teach you first at AUD school, and these are alligator pinchers.
Yep.
But assuming that there's nothing an outlier that's different, you would still somewhat treat it the same way.
Yeah, exactly. Okay. If there's wax in there that's going to be problematic or is problematic, I'm going to go in the same way and I'm going to remove it very carefully. Yeah. I learned my lesson on that, breaking that dam one time. Yeah, very carefully. And also you want to really monitor the patient's comfort level there. So the age of the wax can be determined by the by the color.
Oh, wow.
As the wax is in the ear longer and longer, it's going to get darker and darker as it dries out and ages. And what happens when it dries out? I've seen it black as onyx and hard as glass.
Wow.
And so you go in there and you try to take that out, and you can actually create cuts in the ear canal because the edges of that wax are so sharp. And I mean, years it's been in there. Wow. So you have to just be really, really careful and mindful. And as an audiologist, I see it all the time. So I kind of know what I'm looking at and what I'm doing and how to approach it. But yep, all the above. You just take it out the same way, being very careful to monitor for those ear infections and patient comfort. Yep.
Well, it's going to be a great episode when earwax is on the menu.
On the menu.
Maybe a poor choice of words. So if you want to learn more about earwax or anything else audiology related, you know what to do. Go to askanaudiologist.com. Dr. Michael, excellent stories. Excellent job today. Thank you.
Yeah, on the menu.
We'll see you guys next week.
Take care.
You can find more information at askanaudiologist.com. And you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
The age-old question. Why did a ball of wax fall out of my ear? Something that we have all asked ourselves and our friends and our families before.
Because your ear is doing what it should be doing.
Thank you guys so much.
Honestly.
That's a wonderful episode.
Bye. See ya. Yep.